It took me passing out and going blind to realize that I had been experiencing medical gaslighting and that it had affected the way I had interacted with my doctors as I dealt with kidney failure. Before suffering through kidney failure, I've had to deal with bipolar disorder. I was diagnosed in my early 20s, and as I've moved, I've gone through a couple of different psychiatrists. Now, dealing with bipolar disorder, there isn't a specific medication with a specific dosage that will help you be able to deal with life. There are a whole bunch of medications and you just have to try them and you have to see if they work and you have to try different amount of dosages. So it's really frustrating and it takes a long time to be able to find a combination of medications that will work for you. Often I would be talking to the psychiatrist and talking about how this medication was affecting me and how I felt like I was experiencing side effects from it. And more than one psychiatrist would stop me in the middle of my explanation and say, "You're not taking enough to be able to be experiencing side effects from the medication." That statement would silence me and I just stopped talking in mid-conversation and mid-thought. And I remember trying to kind of breathe in as I tried to hide my embarrassment as I had somehow interpreted what I had experienced wrong. My psychiatrist's statement of, you're not experiencing those side effects basically gave a quick high five to all of my negative thoughts and emotions, and it did affect my self-confidence. It made me question what I should or shouldn't share with the doctor because some things are safe and some things might not be safe, and I didn't want to feel embarrassed again. It created a wall between me and the doctor. It made me feel like somehow I was the child and the doctor was the all-knowing adult. That disconnection, I think, is all too common. I mean, it makes sense. The doctor has years and years of education. They've looked at the studies and analyzed them. They've seen a lot of patients and seen how these medications affect other people. So it made me think that the problem lies with me. And because of losing this self-confidence and not feeling safe with what I should share with a doctor really affected how I interacted with my PCP and my nephrologist at the beginning of my kidney journey. But I did have two experiences dealing with medication as I went through my kidney journey that really helped me to build up my self-confidence and helped me to become a better health advocate. And I'd like to share those stories with you in hopes that it will help you to gain more confidence in your ability to talk with your healthcare providers. The first story has to deal with Losartan. Now, Losartan is a blood pressure medication. I was taking it because not only does it help with the blood pressure, but it also helps with proteinuria. And I wasn't taking a high enough dose that it should have been affecting my blood pressure. Just as subscribed, I took Losartan right after waking up. So one morning, I got up, took my medication, and I felt like I had more energy than I had in a while. So I decided to make a quick trip to the store, get some extra supplies, and make a nice breakfast for everyone. So when I headed up to the store, I went to Walmart. There weren't very many people there that early in the morning, which I should make note of. But I went and I got my cart and I started to head towards the grocery section of the store. And I started to feel dizzy and lightheaded. And this had happened before. And I was like, okay, I'll just keep moving. I'll keep my hands on the cart and I'll be okay. But as I was going, it didn't pass. Instead, it got worse and worse. And so I ended up kind of leaning on the cart and it didn't get better. Things started to, how it starts to kind of sparkle, like flashes of light around the outside, and it started to kind of narrow and I started to feel nauseous. And I was like, I can't pass out and I don't want to draw attention to myself. Especially because I envisioned myself passing out at Walmart and somebody finding me, calling an ambulance, and there would be like this big old scene, and really all I needed to was to let time pass because, like I mentioned before, this had happened before and I just lay down and I'd be fine. So I knew I needed to sit down, and I didn't want to sit down on the ground or on the floor because it's dirty. And this was after COVID, and so Walmart had removed all of their benches. They used to have benches kind of sporadically around the store, but they were all gone. So I headed to the shoe department, and at the end of the aisle, they have extra benches for you to sit down and try on your shoes. And I kind of pulled up the cart alongside that, and I sat down there and I leaned back, and it wasn't helping. It was just getting worse and worse, and this nausea and feeling cold, and things just getting darker and darker. So I ended up just kind of laying out on this bench, and out of the corner of my eye, I could see one guy kind of moving around, and it looked like he was not really into what he was shopping, but like, what is this crazy woman doing? That's what I was thinking. And I remember just thinking, okay, keep your eyes open, because then, nobody's going to call an ambulance on you. So I don't know how long it was. It couldn't have been too long, maybe 15 to 20 minutes. And it finally passed, and I felt much better. I don't remember if I finished my shopping and got my supplies or if I just went home. Knowing me, I probably pushed through, grabbed a couple of things, and went home. But I began to question what I had been told earlier about experiencing side effects. And I was thinking, maybe I really had been experiencing all these side effects, and maybe the doctor was wrong. I started taking notes and being more aware of how I was feeling. And I noticed that 45 to an hour later, after taking this Losartan, I would have these little episodes of feeling dizzy and faint. So I started to take my blood pressure, and it was dropping. And so I felt like I had proof that my body was really sensitive to medications. But then that little voice in my mind was like, well, that might not be enough proof, because the doctor could be thinking that you're making up these numbers, or maybe you're not taking your blood pressure correctly. So in my second story that I have, this is where it really solidified and gave me proof that I needed to be more confident in my experiences, and that my body really is sensitive to medications, and I do suffer from side effects. My second story has to do with prednisone. Now, prednisone is a steroid, and I was taking it to lower my immune system. Now, I experienced a lot of the normal side effects you would from taking a steroid. I got the moon face, I had the mood swings, the agitation, the food cravings, especially carbs and comfort food. I'd get muscle cramps and headaches. But I did experience one side effect that is not common. In July of 2021, I could tell that there's something off about my vision, but I wasn't sure what it was, and I didn't think it was a big deal. So I just went to the dollar store and got myself some inexpensive readers, and that kind of helped, but it always seemed like my eyes were tired and that my glasses were always dirty. About a month later, I was driving to pick up my husband, and of course it was night, and dark and stormy night. It was raining, and I had been to this location before to pick him up, but never at night. And I remember driving and not being able to see. I couldn't read the street signs as I would pass by, or I'd have to get close enough to them that I would kind of have to swerve off the road, and I got myself lost. And I called Jim, and I said, I was in tears and kind of panicked, and said, I can't see. I don't know where I am. I don't know how to, I shouldn't be driving because I can't see. I cannot see. And it was very scary. I was able to, with him on the phone the whole time, I was able to get where he was, and of course he drove home. And I went to the doctor right away, and I found out that I had cataracts. But these weren't normal cataracts. These were fast-growing cataracts. So for the next 4 months, I was unable to drive, and I slowly lost my vision until I was able to get eye surgery. Now, that's not a common side effect to get from prednisone. Usually, it's bodybuilders who have been on a high dosage of steroid over a long period of time. But I hadn't been on prednisone for very long, and I wasn't taking this massive high dose to be able to get cataracts. This was a big deal to me. It was proof that I needed. It was a physical sign that my body is sensitive to medication. Cataracts isn't something that my anxiety or my mental state had created. It was real, and I felt like it was something that a doctor couldn't dispute. I was, and I had been experiencing side effects from the medications I'd been taking. My body is just really sensitive, and if there is a side effect, I most likely will be experiencing it. Now, when a doctor says, well, you're not really taking very much of that medication, I'm able to just shrug it off, and it doesn't affect me the way that it used to. I often will just have to say, yeah, I know, but my body is really sensitive. I even got fast-growing cataracts from taking prednisone, and that seems to be enough. I don't know what they write down or what they're thinking, but it doesn't matter because I know my body and what I'm experiencing is real. Going through this has made me more comfortable with sharing my symptoms and what I'm experiencing. It also made me want to help others to gain this kind of confidence when talking to a doctor so that they can feel like they have more control over their health. Have confidence in yourself as you speak with your healthcare providers. Don't be embarrassed. Don't be afraid. It's okay to ask questions. It's okay to have a discussion with your medical team about the medications you're taking. Read about them. Read about the side effects that you could be experiencing. And it's okay to ask the doctor, why am I taking this? Why have you chosen this? Is there a different option that I could do? You are the best and sometimes the only advocate for your physical and mental health. Take that seriously because it is a job, and don't let anyone downgrade what you're experiencing. You are the one that knows your body the best, and you're the one living your life. That is enough to make your ideas, your thoughts, your experiences valid enough to share with any doctor or any nurse. If your doctor isn't listening to you, don't automatically think it's a me problem like I did. Go and find a doctor who will listen, who will take what you say seriously. Thank you so much for taking the time to watch my videos. I hope you guys all have a great week. Thank you.